My mom's got problems, and she's got issues that I can't help her with.
My mom passed away like 2 years ago.
I don't have a family.
I'm just basically on my own.
I have a baby, and his dad kind of hit me.
They told me the same day that I had to get out.
Then she kicks me out, and I'm on the street.
This is what I would do. This is where I would stay, Especially being homeless, this is like the best place to be.
I'd sleep on the street, and I didn't care if people walked by me and I was sleeping.
It's very, very hard to keep up with everything when you're living in a park and you're homeless. It's very, very hard to do.
Yeah, I'd be afraid to sleep at night because I'm afraid that someone's going to come after me or someone's going to jack me or anything like that.
There's like drug deals being done like right in front of you, and gunshots at night, and I just think it wasn't healthy for me and my son.
Somebody died the other day right on the side of the street.
This life it's like a maze. You don't know what is hitting you on the next corner.
Lost and found. That's what I read. It's lost and found.
When we think of the homeless, we think of adults. The panhandler on the street corner. What we don't see are the young, kids 14, 17, 20 years old. Youth in this age range are considered very high risk. Suicide is the third leading cause of death among those 15 to 24 years old. Every 2 hours, a young adult commits suicide in the United States. And among Latina girls, 15% will attempt suicide. Saul is an outreach worker for Pacific Clinics. His job is to find and connect with youth in need.
These are the alleys in Pasadena that we used to drive by and find a lot of the youth. Places like this where they can hide their belongings and cover it up with some sheets. People tend not to look at stuff like that. That mattress there looks like trash, but it's probably somebody's bed that they use in the morning. That's what a lot of them tend to do, roll stuff up to make it look like trash, but they tend to use it.
Some of the issues that are very prevalent with the young adult population is the homelessness. Many of the young adults that we're working with are either transitioning out of foster care systems where they don't have a place to live, and they don't have the traditional parents that would keep you at home till you're 25. So now they're 18 and they have to figure out how to make things work, and many of them end up homeless.
During the course of a 2-year period, we found close to 400 homeless youth in our backyards of Pasadena, Pomona, La Puente, El Monte, and Baldwin Park. And we provided services for them and connected them to all the resources that they needed.
We can help you guys find permanent or temporary type shelter if you guys need it right now, depending on your situation.
And in really trying to find the services in the spots, later they began to trust us. They wanted services. We began to become known in the streets, someone who could be trusted, because many of these young adults feel that they don't trust the mental health system anymore.
Through public and private partnerships and individual gifts, Pacific Clinics opened drop-in centers, offering services to TAY, or transitional age youth, 16 to 25 years old. Today, there are centers in 3 counties serving 1,800 young adults. These TAY centers offer services to an extremely vulnerable population.
Many come in having had trauma or violence in their lives. Many are using illicit drugs. Some come in feeling depressed or anxious.
Up to 80% of this vulnerable youth population have some sort of mental illness. Of those involved in gang activities, about 70% will have a mental disorder that will emerge before the age of 25. Nearly all youth who have mental illness frequently abuse drugs and/or alcohol.
These young adults are self-medicating to find some relief, to get away from the everyday struggles that they're encountering.
When they're on the street, the best way to cope with being on the street and not being able to think about what's going to happen next is to get high or get drunk and that makes their mental illness even worse.
Services provided by the Pacific Clinics team help young adults access mental health services, locate housing, search for employment, and reach educational goals.
So I would like to set up an appointment with you for this week.
The TAY centers offer these youth a place to socialize with their peers in a safe and nurturing environment.
Some of the other services we provide, other than drop-in center services, are intensive mental health services. We have full-service partnership programs which provide mental health therapy, intensive case management, and medication support.
This comprehensive approach has a high degree of success, helping hundreds of young people transition to more stable lives.
So I think success is measured by, different ways, and the way I see it, I think everyone that we've spoken to and we've helped has been a success, at least for me, because I know that I've gotten them to a safe place instead of being out in the street.
All of this contributes to our ultimate goal of helping youth achieve independence so they no longer rely on the mental health system. At Pacific Clinics, we want to get them off the street and into a life of recovery and wellness.
If not for Pacific Clinics and for the wonderful staff, I'd be on the streets, definitely.
And it gives me hope that I have somewhere to go.
They did save me from a lot.
Yes, it made my life way better.
They give me that hope that they're not giving up on me like other agencies have.
And it gives me comfort that someone is willing to put their hand out and say, hey, I'm willing to help you.
It was amazing. I actually was able to work with them to find a house, get in school, go to the doctor.
I was trying to finish school off, and it was really, really hard. They started helping me with that.
Told me there was classes I could take, things that I didn't even know can be offered out there.
It actually got me wanting to do something with myself.
I'm thinking of taking some college courses.
I'm currently enrolled in college, and I'm almost done with 2 AAs.
I'm going to be the valedictorian of my class.
If it weren't for Pacific Clinics, I don't think I'd be here. So they gave me that hope of wanting to live, wanting to not just see myself become someone, but see my son become someone.
Pacific Clinics has changed my life, big time.